Hey, welcome back with News with the Loon. And right now, on August 14th, 2025, we are going to go ahead and hit some local news. Now, the first one we are going to hit is something that I have been following for a little bit ever since this has occurred. And go ahead and start looking at there we go. We're going to go ahead and take a look at this outbreak that has been going on in Harlem. I think it's been about 2 weeks. And we are going to take a look at what the mayor has to say when dealing with as things have developed. As you know, on Tuesday, I did a quick broadcast basically stating that they had an emergency town hall meeting. It was virtual for people's health and their safety. So let's take a listen and see what they have to say during this press conference.
To really give you an update on the Legionnaire's disease outbreak that we experienced in Harlem. And I really want to thank the Commissioner Morris over at Department of Health and Mental Hygiene, Dr. Katz, who's joining us, and our partners here in Harlem, Assemblyman Wright and Senator Claire. Both of them have really been on the ground, taking down the tension and answering questions, because when you have a Legionnaire's disease outbreak, there are so many rumors that will fly around, and if you don't have who can assist us in answering the questions, it can just add to the panic and confusion and uncertainty. And when this first came on our radar, the commissioner team immediately arrived in Harlem and put in place a plan because they're not new to these form of outbreaks. We know what to do and immediately kick into gear, and that's what she did. And I want to thank her so much. I know the Central Harlem community and many New Yorkers are anxious because you have so many unanswered questions, and we wanted to make sure we did just that. And so I want to reassure everyone, the air is safe to breathe, and there's no risk to our drinking water or our water supply. As a matter of fact, why don't you guys go get me some water so I can drink it and people can see it's safe. And so I'm standing here right in the middle of Harlem, breathing the air. In a moment, I'm gonna take a drink of water. And as I'm just telling my Harlemites, take a deep breath. The situation is under control, and DOHMH and our entire medical team responded. And I really want to thank Harlem Hospital. They have been a real partner as we brought the situation under control. 11 of the 12 cooling towers that tested positive for this bacteria have been remediated. And the 12th and final cooling tower will have remediation complete by tomorrow. When we identified a location, each location had 24 hours to remediate the situation, and the building owners in this area, they were extremely cooperative. The other good news, if we could have good news out of this, is that, so let me say it another way, we have taken the necessary actions to keep people safe, and I'm moving in the right direction towards the end of this outbreak. On day one of this, dedicated men and women in New York City Health and Hospital and our teams responded and treated the patients in Harlem. 92 New Yorkers have been diagnosed with the disease by health experts, while 15 people are currently hospitalized and are receiving care. We have, however, unfortunately received 3 loss of lives due to this outbreak. And our hearts goes out to the family and the community and their loved ones. The New York City Health and Hospital and our health department acted quickly to keep New Yorkers safe and save lives during this cluster. And I want to thank them for their work in stopping the spread. And frontline heroes, we stand here at the podium, but every day they're out there 24/7 providing the necessary information, update, and care. And they do it in a very dedicated way. And this was an all hands on deck moment. We all kicked in gear. We all made sure that not only on the ground, but our health professionals here in the hospital was also monitoring the information, giving us information so we can maintain updates for New Yorkers. At this time has shown time and time again that in a moment of crisis, we see our professionals step up. While the cluster has been contained, but still New Yorkers who live or work in the affected areas to seek medical attention. If you have flu-like symptoms, our team has boots on the ground here in Harlem, and we'll continue to monitor the situation. But I want to turn it over now to Commissioner Dr. Moss to give you any further updates. Commissioner.
Thank you, Mayor, and thanks everyone for being here. Thank you to my colleagues at Health and Hospitals for hosting us, to Senator Clear and Assemblymember Wright for your collaboration. As New York City's doctor and acting health commissioner, I'm here to address the health department's response to the cluster of Legionnaire's cases in Central Harlem, where we stand. This has been our top priority since we detected the cluster on July the 25th. As promised, we are keeping you updated every step of the way, and I want to give an update on what we know as of today. We have 92 people who have been diagnosed with Legionnaire's disease. There are 15 people who are hospitalized, and tragically, 3 people have lost their lives. Any loss of life is too much, and I offer my deepest condolences to the families and loved ones of the deceased. At the health department, we're doing everything we can to minimize any further spread of the Legionella bacteria. And to clarify, Legionnaire's disease is caused by Legionella bacteria that grows in warm water. It does not spread from person to person. It can only be contracted by inhaling mist or water vapor that contains Legionella bacteria. In the summer months, Legionella bacteria grows even more easily in cooling towers that are located on the top of buildings. These towers spray mist and droplets that can carry bacteria. On July the 25th, when our team became aware of this cluster of Legionnaire's disease cases, our response was immediate and multi-pronged. We mobilized our expert inspectors to immediately take water samples from all cooling towers in the investigation zone. And then they took those cooling tower water samples to the health department's public health lab for testing. At the lab, all of the samples were tested with both preliminary rapid PCR tests as well as culture tests. PCR rapid tests identify traces of Legionella bacteria, and PCR testing is the first step so that we can quickly order treatment of towers to be cleaned in an attempt to stop the spread of bacteria. PCR tests, which are rapid, are not as comprehensive as culture tests. The PCR tests cannot distinguish whether the bacteria are dead or alive. Dead bacteria cannot make people sick, so that distinction is important. Culture testing is the gold standard, which is why it's an integral part of our process. It is more precise in detecting the presence of living Legionella bacteria, which is the kind of bacteria that can cause people to get sick. However, the culture testing takes about 2 weeks to get the results. While we waited for the results of the culture tests, our team did take action. 11 cooling towers had positive rapid PCR tests on the preliminary testing round. All of those 11 buildings that had initial positive results were immediately directed to sanitize and remediate their cooling towers with antibacterial treatment within 24 hours, as the mayor described. All 11 buildings complied with that immediate and urgent remediation. Recently, the health department began receiving confirmatory culture test results as anticipated from our public health lab. Those confirmatory results revealed that 12 cooling towers had Legionella bacteria growing. As of today, 11 of those 12 coolings have been remediated. The final cooling tower remediation is underway. We, as of right now, are releasing a list of all 12 cooling towers that were positive using the culture test. Again, that's the gold standard test. We're requiring cleaning and antibacterial treatment of those 12 towers. What this means is that, yes, these buildings were positive for the kind of bacteria that can cause people to get sick, the Legionella that can cause illness. It does not, however, mean that we have identified the specific cooling tower that may have caused illness amongst the 92 people who fell sick with Legionnaire's disease. That is why our investigation is continuing. And per our protocol, the New York City Health Department's investigation on the source responsible for Legionnaire's disease cases in Central Harlem is underway. Right now, the health department's public health lab experts are comparing the DNA in the cultures grown from the 12 cooling towers to the DNA in the samples from patients who fell ill with Legionella. Molecular analysis of Legionella bacteria from patients and cooling tower specimens will help us to determine a possible match. I want to be very clear also and transparent and share that the New York City Department's Central Harlem Sexual Health Clinic had a cooling tower that tested positive. The tower was offline the weekend of July 26th for planned maintenance, so we proactively cleaned and disinfected the tower at that time. We're optimistic that the risk of contracting Legionnaire's disease today is dramatically lower than it was a few weeks ago. We are watching the data extremely closely. New cases have begun to decline. That indicates that the source of the bacteria has been contained. Now, while the initial rapid tests did not identify all of the contaminated cooling towers, the data suggests that that immediate action to decontaminate those 11 initial cooling towers was effective in identifying the most impacted buildings. That ultimately lowered the risk of exposure while we waited on the confirmatory culture tests. We're continuing to urge all New Yorkers who live or work in the identified zip codes in Central Harlem who have flu-like symptoms to contact a healthcare provider immediately. Legionnaire's disease can be effectively treated with antibiotics when it is diagnosed early. Our team is still working to get the word out to the community here in Central Harlem by running ads on Link NYC boards in Central Harlem and on popular NYC radio stations, flyers in the neighborhood, which we were doing last week, sharing information at our East Harlem Action Center, making press appearances and answering questions on social media. Our mission at the New York City Health Department continues to protect and promote the health of New Yorkers. If you, your family, friends, or neighbors have questions, please visit us online at nyc.gov/legionnaires for daily updates, including the hospitalization data, or you can call 311. Thank you. I'll pass it back to the mayor.
Thank you. Thanks so much, Doctor. I want to bring on our state senator and followed by our assemblyman. Senator Cole.
Good afternoon, and I want to start by thanking Mayor Adams and his administration for quickly addressing this crisis in our community and for their aggressiveness in containing this bacteria. Like the commissioner and the mayor, my condolences to those families and their loved ones and everyone that knew them. My concern now is great towards what we will do in the future, and I look forward to the results of this investigation. It is, to me, very curious how this bacteria problem seems to always turn up in Black and brown communities. We have to figure out some form of prevention. There are cooling towers all over this city. I don't know what the disparity is that causes this, and that's of great concern to me in my office. We are looking into ways to even increase monitoring and inspection. And Assemblymember Wright and I have legislation that we have introduced in the state level, and we're looking at more legislation because the fact of the matter is, as much as we have responded to this, 3 lives is too many. And our communities cannot continue to serve as the canaries in the coal mine. We have to find a way to prevent this problem, which seems to start as a maintenance issue and should be easy and preventative. So we're going to work with the mayor and his staff to make sure that we get information out to people so that people can take care of their health needs. We're going to work with him to make sure that we get information on how it's spread and make sure that people know that. But I look forward to working with you in the future to make sure that we can prevent this from happening in any more of our communities and no other lives have to be lost. Thank you.
Thank you. Thanks so much, Senator. Assemblyman.
Thank you so much, Mayor Adams, the administration, Commissioner, Harlem Hospital for being great partners. And like all before me, I want to express my condolences to those who have lost their lives. One life is too many, so 3 is far too many. Want to take a second to remind the Harlem community that information is out there on what to do. If you have a sore throat, you got the chills, you have a fever, do not hesitate. Go see your doctor as soon as you are able. This is a treatable situation if caught early. So if you catch it, please, please, please go see your doctor. We have a beautiful hospital here, Harlem Hospital. We are all here to service you. Thank you all so much.
Faucet water, right? Bottle. I don't want anybody to say that we try to pull a scam. Well, straight from the faucet. You personally got it, right? Okay.
Cheers, sir.
Drink up, breathe up.
Mayor, is this the failure by the city for not checking the cooling towers in its own locations? I know there's been criticism for the other locations that have been keeping up with the maintenance. So what does that say about the city? And what would you say to the people who are treated here for Legionnaires?
They're part of H&H system, finest hospital system, probably in the country. And so they are in good hands. The expertise of doctors under the stewardship of Dr. Katz and the entire H&H, particularly Harlem Hospital family, they are in good care. You have the inspection information? Yep.
Thank you for the question. So we at the New York City Health Department certainly are responsible for compliance of our buildings, in addition to being the regulator and inspectors for the buildings all across the city. So our building, specifically the sexual health clinic, as I mentioned, was offline for the weekend. We did a full remediation of that building. And in addition to that, we had results from very recently, as you are probably aware. The law in the city and state says that every 90 days Legionella must be tested. And so we do have the results confirming that that was negative very recently prior to a later positive test. That is why it's so important to acknowledge that the testing is important and the maintenance is important, but even that rigorous schedule, there is still possibilities that bacteria can grow because of the conditions in warm weather. And so I think it's really important to acknowledge, just like if you get a colonoscopy, for example, that doesn't mean you're not going to get colon cancer. Our prevention efforts are incredibly important, but they don't always prevent 100% Legionnaires like what we've seen this cluster.
Do you know if this was the center of the outbreak?
So our investigation is continuing. And I know that that is not always an easy answer to hear because it does take time. And the complexity of the testing that we do to confirm the specific source of the outbreak for this particular cluster does take time. So what we're doing currently is our public health lab, which is one of the most specialized public health labs in the whole country, is doing DNA sequencing. That is both expensive, rigorous, and really important testing to be able to identify if there is a match between the 12 cooling towers that were culture positive and the patients whose samples we've been able to also sequence for DNA. So we don't have the final results of our investigation. It is ongoing.
You'd be proud of me, doctor. I got my colonoscopy.
Is there any plan in place right now to stop this mist or these droplets from spreading? Like, is there any way that you could create some sort of a barrier from it from dripping into places where New Yorkers are coming into contact with this?
Thank you for the question. The most important actions have been taken already, which is to do an initial remediation of any cooling tower that tested positive in the PCR. So the 11 cooling towers that tested positive within 24 hours were required to increase the biocide antibacterial treatment or add a new antibacterial treatment to make sure that any bacteria that were present were eliminated. So that's the first step that we did quite immediately within a few days of identifying this cluster. The next round of more full remediation is now happening because we have the culture results. So that's the second round of intensive antibacterial treatment of the cooling towers that tested positive in the culture. That is the best way to prevent any bacteria in water droplets from being inhaled by people in central Harlem. So those steps have been taken. Sure.
Given that Legionnaires tend to affect people with comorbidities or other health problems, and the hospital is a place where those kind of people are being treated, is there a possibility that more people were exposed here than might have been in other places?
I appreciate the question, and we are very much concerned, of course, about the people who have risk factors for Legionella. And just to clarify, the risk factors for complications from Legionella or for poorer outcomes are things like being over the age of 50, if you have chronic disease like lung disease, if you're a smoker, if your immune system is not working well. Those are really important risk factors for a poorer outcome from Legionella. However, complete, so I would not draw any conclusions yet about additional or specific exposures. The whole goal of our investigation is to both make sure that New Yorkers that are at risk in the zone of the investigation, the 5 zip codes in central Harlem, know that they're at risk and seek care immediately, while at the same time, we urgently do the antibacterial treatment of the cooling towers. So I can't draw any conclusions yet about more risks in certain zip codes than others until the investigation is complete.
Just to clarify, you were saying that the clinic that was recently offline, is that the 12th and final cooling tower that still needs to be remediated and will be by tomorrow?
Our sexual health clinic has completed its remediation.
Are you releasing the location that hasn't been remediated yet, or is...
We released the 12 locations that had cultures that are positive. Remediation has been completed for 11 and is ongoing for the 12th.
And for anyone who's getting familiar with the story now, looks at this list of locations, maybe lives in Harlem, and is trying to figure out if they visited any of these buildings in particular, do we know for certain that you had to have visited these buildings, worked, lived in any of those buildings to be at risk, or could you have been walking by? Like how, in terms of proximity, how at risk are you?
The most important thing that I'll tell you, and I'm glad you asked that clarifying question, is that anyone who lives or works in the 5 zip codes in the central Harlem cluster that we're investigating was at risk. And that's what our messaging has been. We've done messaging in multiple languages, in multiple zip codes, and in multiple radio, media, social media, and other outlets to make it clear that anyone who works and lives in those 5 zip codes was at risk. And in addition to that, part of the reason we didn't release the initial 11 cooling tower locations that tested positive by the rapid test is for the reason you just described. We did not want people to think, well, I don't live there, I don't have to worry. That is actually the exact opposite response from what we wanted. What we wanted was for people in all 5 zip codes to be on high alert for developing any flu-like symptoms and to immediately seek care. The new 12 culture results, again, have been remediated fully or are almost done with remediation. And just to clarify what remediation is, remediation takes 2 pathways, but it's essentially the action that the building manager and engineer together would take to clean the cooling tower. There's an initial more rapid version, and then there's also a more full version. So remediation is an antibacterial treatment of the cooling tower.
Forgive me if this was addressed earlier, but were any of the buildings where the cooling towers were identified repeat offenders from previous years? And also, are those building owners facing penalties, fines? Is there anything to dissuade them from letting it get into the state of disrepair?
Thank you for the question. All of the building owners are following our orders for remediation, and they have all been in compliance with our orders for addressing the positive tests that we found. Let me just finish. That we have found in this particular cluster. So we're glad to see the compliance with remediation right now. As for the question about when was the last inspection and what was their prior compliance record, I don't have that information right now, but we can certainly follow up with you.
Would they be facing penalties for allowing the Legionella to develop?
The building owners are in compliance right now, so that no one has been fined for the current cluster that is happening right now. But we can follow up with you for any further information about historic inspections.
Just a little confused. They're in compliance because they took steps after the fact. But does that mean that they were in compliance leading up to this point?
I'm commenting right now on the current efforts because of the urgency of the current cluster. Our most important priority in the immediate time to protect the health of residents and people who work in Central Harlem was to make sure that those building owners immediately did an antibacterial treatment of the cooling towers that tested positive. So I'm commenting on the fact that currently, to address the health concerns of Harlemites in the 5 zip codes, the building owners have done what we've asked them to do, and they've done so urgently.
The thrills never stop at Empire City Casino.
All right, there you have it. That is the current update officially by the New York City government officials. They are working as quickly as they can to resolve this issue. And I let that news conference go through because we have been following this particular issue within the New York City area. Now, when it comes to, and I'm going to go back to this, let me just see. I don't like to show advertise. So let me go back to the article here for you. There we go. So we're going to go back to the article because there's some key important information within this article which needs to be shared. First thing I'd like to share within this article is the zip codes that are affected. I know I've said it several times, but what we want to do is make sure. So the zip codes affected is 10027, 10030, 10035, 10037, and 10039. Now, there is an extra element that they add that I want to, as well as they announce the locations of the origin points of the outbreak, and the locations are as follows. Okay, so even if you don't live within these zip codes, if you have visited these facilities, it is very important that you do go and if you're feeling flu-like symptoms, that you seek medical assistance as soon as possible. Because like they said in this little briefing, if you catch it early, it can be resolved. Now, I do have them posted here, but I'm going to say it just in case you're just listening and walking. One of them is NYC Health and Hospitals Harlem Hospital at 506 Lexington Avenue. The other one is BRP Companies Lafayette Development LLC at 2239 Adam Clayton Powell Jr. Boulevard. The other one is Commonwealth Local Department at 301 West 124th Street. The other one is CUNY, City College Massac Science Building, 181 Convent Avenue. The other one is Harlem Center Condo at 317 Lexington Avenue. The other one, NYC Economic Development Corporation at 4137th Street. Next, New York's NYC Health Department Central Harlem Sexual Health Clinic at 2238 Fifth Avenue. This is one that she mentioned within the briefing. The next one is the New York Hotel Trades Council Harlem Health Center at 133 Morningside Avenue. And the last one is Wharton, please, at 100 West 125th Street, 3 of 8 towers. All right. So this is due to the water towers. Now, just because this is happening in Harlem, I do have to state that just because this is happening in Harlem, she has described to you, which to tell you the truth is news to me. So I'm sure it's news to you, that this is discovered within water that is found, that is outside due to the heat, humidity. So if to all New Yorkers, it doesn't matter if you are in Harlem or if you happen to be anywhere else. If you happen to be one of those people who like room temperature water, you may want to take caution in the water you leave out on your table and you don't have the air conditioner going for whatever reason. So if you require drinking water, keep it in a refrigerated area, just to remain safe. Because just because this outbreak is isolated in Harlem, it doesn't mean that we may not see another outbreak anywhere else. So now we are aware of this. Now we can take precautions and you could be aware. And to everybody within the Harlem area that's going through this, our prayers are with you. Now, we're going to go. This was a very heavy one, but I had to cover this one because this is something I've been following for the last few weeks. We're going to go on to our next article in the local New York City area. And who here is a Bojangles fan? Who here remembers when Bojangles used to be in New York back in the 80s? Well, if you are a fan, you happen to love Bojangles, guess what? They're coming back to the New York City area. What happened is chicken biscuits and tea back up to the New York City area. And the Bojangles chain has announced that they plan on opening 20 in the entire 5 boroughs. So Chick-fil-A, look out. And 35 locations in New Jersey. Okay. The first location is slated to open in the winter, hopefully in East Flatbush, Brooklyn. So get ready. Bojangles is coming to New York, so you don't have to go on a road trip anymore if you happen to be a Bojangles fan. Now, staying along with the theme of our restaurants, a few more restaurants opening, and if you can't wait till the winter, here are a few restaurants opening. We have the Thai diners. Next trick is Mommy Pies. It's a new casual takeout window dedicated to chicken fingers. It opened on Friday, August 8th on 203 Mott Street at Kenmare Street. Okay, so that's one place if you want to check out. Now, these are the openings that you could go check out as of today. We have one in Penn at the Penn District. Sariano's Italian opened on Tuesday, August 12th, in the Javits Center in that district. And there's a lot of great fruit eating there. But they will be located at 132 West 31st Street between 6th and 7th Avenue. At Sunnyside, yes, we are going to Queens. We have the Sconery opened. If you like scones, this is where you want to go. They opened this Tuesday in Queens at, they have several locations actually, at 39-39 47th Avenue between 39th Place and 40th Street. Okay, so if you like scones, that's the place you want to go. And then we have the Upper East Side. It's called Libby, and they're a Mediterranean restaurant, and they are kosher. And they are located at 205 East 81st Street between 2nd and 3rd Avenue. Now, what I'm going to do, because this is a very, very long list, and it's very eclectic, different styles. But then again, if you want good eats, it's a place to be. So we're going to go ahead and put this article in the chat. So if you are feeling a bit peckish and you want to check out some real spots throughout the city, because it is not just located in the city, but within the 5 boroughs, you could check out any of these places. For all of you that are, in relationships, it's a nice date night. For all of you guys who actually just wants to go out and hang out with your friends, this might be the venture you want to go on. Okay. Next off, are you into IT? Do you want to get into IT and you happen to be a New York City worker? Well, DCAS has kicked off the IT Management Academy for government tech leaders. This is a big one for those of you who want to get into tech or are in tech and want to work for the city. The DCAS, which is also called, I do apologize, they are the agency, and they have a 27 full-time public sector professionals from 19 agencies who are in director or above roles and this is set to last about 3 months. This is another article I will put in the chat for you, because this will, if you want to partake, this will have links so you could go ahead, go through the guide, and get your IT on, as I would like to say. And it opens up new avenues for those who want to follow this career field. Okay. So if you are interested in this, there is the link because they have the new training program, which you could click, and you will be taught by professionals that are already in the field and already working in the IT field and within the city. So if you want to take advantage of this opportunity, this is the time. And as usual, I always like to share something that is joyful and leave heart in a good place. So this is a video of an orphan otter which was released into the wild by its human savior. And this is a reminder that it's the little things you do in life. You do it out of the kindness of your heart, and it sometimes is always rewarding. Until next time, this is the